leaders on with me today. I'm very excited about today's show and just want to thank all of you for taking your time out. We're in busy times, and all three of you have taken your time out to be with me. You're in different locations, different parts of the U.S. So thank you, all of you, for being here. I'm going to pull it up and make sure that we're all live here. And yes, we are. We are live here. Okay, very good. So folks who are just not coming in, let us know where you're signing in from, what city, what state, what country. Again, I've got a great panel. We're talking about how we can create better connections in 2022, inside, outside the industry, nurse leaders, others in healthcare, just everyone. How can we make better connections? So let me go through our roundtable. In fact, I'm going to move myself over. Can I move myself over? There we go. See, I move myself to, I want to have you guys all together there. Okay, there we go. So first, on my far left here, we have Dr. Chibuna Nwaobia. Welcome to the show. Oh, no, I was known as Dr. Chibu. Welcome to the show.
Thank you so much. Thank you for having me again.
So glad to have you back. And then we have Ms. Sarah Dembeck. I'm so excited to have you on the show from Vail Health.
Yes, thank you for having me. It's nice to be here.
And I really appreciate you, Dr. Katie Boston-Larry. I know you're in the middle of a very intense course and meeting, a conference, what have you, and you still took the time out for today's show. So thank you for being on the show today.
Thank you for having me. You know I'll do anything for you, Rollis. We go way back.
I know, absolutely. Likewise. You know, Dr. Katie Boston-Larry was one of my first guests on my show when I started doing lives in early 2000. This was before COVID. We didn't know anything about COVID back then. Well, at least I didn't know anything about COVID. Some folks in New York did, but we didn't know much. But anyway, yeah, definitely love having all of you guys here today. And I really appreciate you guys being willing to also speak about a subject that we don't talk about a whole lot. It's really how we can make more meaningful connections. And I want each of you to kind of give us your thoughts, whether you're talking about internally within the organization or whether you're talking about connecting with folks outside the organization, what you value in connections, and some of those things that you value, I think will help some of the folks who are watching to give us ideas on what we can do. So let's talk about this first. Hybrid, in-person, virtual. Where are you kind of leaning towards this year, 2022, as some of the restrictions have been lifted in various parts of the country? Maybe we can start with you, Sarah, since you're first time on the guest. I want to start with you. What's your take right now? Hybrid, in-person, or online?
I think I've transitioned or emerged out of the pandemic and into the endemic with a different view than I may have had a couple of years ago. I love the in-person connections. I think there's meaning behind that, especially as a healthcare provider, that we make those connections. But I have also seen the value of being able to be flexible in that space and be able to have perhaps staff meetings with teams of nurses or healthcare providers that are able to come from wherever they are and be a part of it, whether they're in person or virtual. And I think there's opportunity. We live in the mountains. That's where I'm from Vail. Sometimes there's a snowstorm. We don't need to cancel meetings when some people that live far away into the mountains, they can still join. So I think there's opportunity to do a hybrid. I think that's where I see the future going, but need to ensure, I think, cameras on, being on a chairlift, just like we are today, just having opportunities to really see faces is important in making those connections.
Love that. Great point. And how about you, Dr. Katie Boston-Larry? What's your thought? Hybrid, in-person, or virtual?
Hybrid. I think that's a more progressive take. So I agree that is the way to go, I think, moving forward. And, you know, there's a professional, then there's a personal too. Like there's some relatives that I'm good with the virtual relationship and some people. But I do think in a professional setting, virtual works with particularly with people that you work with that are not too close to geographically to you. Hybrid works with when you're working in a team, and there's that team human connection aspect that comes with, you know, if for a quick touch base and not having to schedule a meeting to ask a quick question. So there are benefits to all three, but I do think a hybrid approach is the way to go.
Awesome. And guys in the comments, I want you to let me know the same thing. Where are you at right now? Hybrid, in person, or virtual? Dr. Chibu, what are your thoughts?
I would say all of them. I would say all of them, depending on the situation. We are also situational leaders. Sometimes you need to see your people in person. You need to feel them. And sometimes too, depending on what the message you want to pass across, you can do hybrid or virtual. But as a leader, whatever, we are relationship human beings. I believe that in person is the best, but you can utilize three of them, to get your message across.
Okay, very good. And we've got some folks coming in. We have Leah's with us. Hello, Leah. Joanne. We have Joe Giblin. Welcome. Appreciate you. Cassandra, thank you for being here. So many of you guys. Thank you for. Oh, we got Jennifer Weisenauer from Colorado Springs, Colorado. Welcome. Appreciate you. Dr. Rosina Malaska. Thank you. And Hayden, good to see you as well. So appreciate all you guys being here. And this is all about connections. In fact, let's take this as an opportunity to connect with each other, right? Those who are in the comments, we're all here for that connection. So let's do that with each other. And of course, those we're also tagged in here as well. All four of us rather are tagged in. So feel free and let's keep the connections flowing. So as we go further in this conversation, what are some things that we've probably learned over the past 2 years that we want to take with us, right? As we move further into 2022. Are there anything in particular that come to mind that you'd like to take with you from your experience? And so who wants to tackle that one first?
Well, let me
go ahead.
Yes, let me jump on that. Number one is connection is very important. When you are doing connection, you have to be intentional. Either you are doing it within your organization or outside your organization. Like I've said, we are relationship human beings. So what do you want to make out of the relationship or the connection that you are making? So I believe that once you know your intention, it gives you, the power to go extra mile to wherever you want to go, to connect to whoever you want to connect to, because the world we live in right now is very small. We know each other, especially in the healthcare industry. We know each other, we work together. Anything can happen anywhere. 2 weeks ago, I was in Chicago, and I met so many people from California. They have moved different places. I said, wow, I never believed that. And I've also met so many people from other places that moved into California. So, that connection is all about intentionality. Where do you see yourself? What do you want to make out of it? Because you never can tell where you will meet each other tomorrow.
Oh, I love that. That's great. Okay. So any other thoughts? Is there anything you want to just definitely we definitely want to take it with you?
Yeah, I think there's a lot that happened during COVID where there was forced experimentation. A lot of things that we knew we had to do, but in our minds and policies and process and whatever, that got in the way of trying new things. And a lot of us got to try new things. And some of those things are things that are going to stick after COVID. And I do think we need to continue to be in that space where we're willing to evolve and try new things and, go through some experimentation of how we can do things better, particularly in healthcare, because the wheels move pretty slow, relatively slow compared to a lot of industries. So I do think that is something that, and which breeds innovation. So I think for me, that is one thing I like to see continue. Vaccines were developed at a rapid pace, like a record pace. That type of breakthrough technology and innovation is I think is where we need to be. So that's what I like to see is more of that, because I think we'll be better for it if we continue to evolve.
I agree with both of those responses. I think, we've learned that through connections and our ability to be nimble and innovative, that is really where we are with healthcare. And that's what's taking us to the new level. And those coming together is teamwork. I've been really impressed with the amount of connections that have created lasting teamwork that's allowed us to do things that we didn't think we could do. And I'd like to see that continue into the future.
Great. And we got a lot of folks coming in. Benjamin, he says, I'm all about the virtual now. Awesome. And then we have Jasmine. She says, hello, everyone from California. Dr. Rosina Malasky says, prefer in person, but realize the past 2 years, hybrid is okay in these challenging times. Marissa says, tuning in from Houston. Good to see you, Marissa. And Dr. Rosina says she agrees with you, Shabu, and what you're saying about all three. And okay, I think I'm caught up. Very good. Okay, so I want to ask you guys a question. It's a very important question. Are you ready? You guys ready? Okay. All right. So my question is, would you rather have the ability to read minds or have the power to make anyone that you like to trust you? Guys, in the comments, I want you to answer that same question. Okay. So Dr. Katie Boston Leary, what would you say to that one?
Trust me, I don't want to read minds. I think that would just, it would just be too much to handle. Because I've seen that play out in a couple of movies, actually. I think it was it a Mel Gibson? Anyway, there've been a couple of movies like that where you kind of see the ramifications of that, where someone's walking by you and you hear their thoughts and that becomes a distraction. I don't need that. If you're not bold enough to tell me how you feel and share your thoughts, hopefully with relationship building it'll come. But if not, I continue to move on. So I do think I think trust would be key, especially when you typically have good intentions. And it'll cut out a lot of, what happens in the middle in terms of building trust and, that waiting game that you have for people to believe in what you're saying. And so I'll take the trust. That's important. And that's so foundational.
Okay. All right. Very cool. We'll see how they are in the comments too in just a second. But so what would you say, Dr. Shabu? Would you want to have the ability to read minds or instantly build trust with whoever you chose?
I'm completely different, but because I have background in psychology, I read minds, and at the same time, I build trust. But why do I say I read minds? I need to know the reason why you do what you're doing. Okay, by constant communication, getting to know, the reason. Like I said, I am big on intentionality. I am very intentional in what I do, and if I notice that you are not in line with, what I want to do, I don't want to waste my time. Okay, trust, I am who I am. So at the beginning, if you're coming and you are not able to trust me, then I don't want to go on, building that trust, getting you to know who I am. I am just who I am. So I'll just, okay, I move on. Maybe in the next 2 years, 5 years, 10 years, you will get to see. So there is nothing as good as, being intentional, knowing who you are, knowing what we are doing, so that you don't have to go and prove to people. Okay, because we are all leaders here. You guys know, at work, everybody wants you to prove to them that they can trust you. I don't want to go to work again to prove to people that they can trust me. I am just who I am, and I want to do the things because, that's who I am. So I look at you, I look at intention, I look at why you are doing what you are doing. Like I've said, I have counseling and psychology background. So once I notice that, my intention or my values don't align with yours, I don't want to waste my time, letting you trust me. I'm just me. So.
Okay.
All right.
Sarah, how about you? What do you think?
I like that thought. I tend to believe that trust is the basis of how we evolve and be able to support each other. And I like the idea of knowing what people are thinking because it does sound intriguing. But I also am concerned about just having trust without building it. I think that trust comes from relationship building. And as we talked about in the beginning, that is really important. That allows for trust. And so trust without relationship building, I think, can lead to maybe a trust that's not true. So, just a thought.
Yeah, that's the thing about Rollis's questions, right? You have to pick the lesser of two evils, right?
You're right. You're right. It's like, yeah, I agree.
Yeah. So
I'm going to go with
the lesser of two evils,
but with a disclaimer.
But the thing is, like, why are we here? We are here for a goal, right? We are here for a vision and a mission. So if we are in for something, for a specific goal, we go work with it. So if you're trusting, are you going to do it? Are you not going to do it? So why are we even doing it? That's where I'm come from. So if we are people and we have the mind to go achieve a common goal, we are moving. So anyone that has trust issue, it's through relationship. I get it. I get it that you build trust. But at the same time, once you're intentional, what are we doing? Why are we doing what we are doing? Why are you here? Why are you moving on? Why am I communicating with you? From the first, time I have checked you out, I know that, okay, we can do this together. But if at the same time, they say it's only a food that doesn't change his or her mind anyway. So if at the same time and something falls off, it is what it is, then you move on. So that's
Okay.
my thoughts.
No, that's good. These are all great thoughts. Okay, I want to get some comments in here. Cassandra says, read minds for me. So she'd rather read minds. Benjamin says, read minds. If I know what you're thinking, I can figure out how to make you trust me. This is the right choice. Trust me.
I don't want to read minds. I don't want any part of that. I don't.
Cassandra is a behavior specialist, so she knows.
Yeah, those behavioral health people, they'll probably want that. Like, I don't want it. I'm good.
Cassandra says, I know genetically some people don't know how to express themselves or say what they mean, so I'd rather know exactly what they're thinking. Dr. Rosina, she says, build the trust. Reading minds would be too much for me to handle. Okay, so this actually brings me to another thought here. Do we feel like, first of all, trust has been built, or did it get a little bit kind of broken down during the pandemic? And if so, depending on what side you're on, how can we either continue to build that, or what are some things we can fix when it comes to building trust if it's not there, or perhaps if it's already there, we want to make it that much better. So what would be your thoughts? Let's start off with, okay, we'll let you start off with Sarah, and then we'll go Katie Boston Leary, and then Shabu. How about that?
That sounds good. So I think that's a hard and interesting question. Without asking, I guess it's intuitive within myself as to where that trust is specifically. I do think there was opportunities for both. Trust was enhanced in certain areas as we protected our staff and our communities with vaccinations and PPE. But yet there's distrust as we continue to look at challenges with staffing and ways to look at healthcare in a different model. And I think for me, the area I want to focus in on is the area that there may be some distrust, continuing and having transparent dialogues and conversations about vision, mission, how everyone can be involved in that. One area I've been doing across our organization is having small coffee talks, a cup of Joe with the ACNO, just discussing topics such as well-being, emerging from the pandemic, even as cases such as the VOT case and how that's feeling and impacting people in just culture, and just in staffing and safety, just getting an opportunity to listen is so important towards building that trust and getting, it's evolving and changing.
That's awesome. Yeah. Okay. Very good. How about you, Dr. Katie Boston Leary? What would you say to that?
Yeah, I think there has been, it's interesting when we had some listening sessions, we heard some nurses say that they feel a sense of betrayal and lack of trust because of lack of transparency and true collaboration during the crisis. And I think that is a relationship dynamic that needs to be rebuilt, and not assume that since we're probably, hopefully, and even though it seems like we're spiking again in terms of infections, we shouldn't assume that everything's okay there with those relationships. And there is a lot of volatility and turnover right now, particularly in nursing. So we have heard that there is a sense of letdown and betrayal and lack of trust, and there's an opportunity there. Because I do think that is something that can be rebuilt. It's not all lost. but there's some humility that's required to get there, that leaders have to have, and own where they may have had missteps. And there were many missteps at numerous levels of leadership. There are numerous examples of failed leadership during the pandemic at numerous levels, even as high as the highest office in the land. So I think that affects everything. And we were also experiencing something we've never seen before. So there were mistakes made, but as leaders, that's part of what we have to be able to do. This NASA, Lessons from NASA book that I was reading is about introspection. That is a key asset for any leader, where after every, at the end of the day, you're reflecting and you're taking into account your actions and the decisions that you made. And it's not to do the woulda, shoulda, coulda necessarily, but it's to look at where in a quiet place, what you did well, celebrate what you did well, own what you didn't do well, recognize what still is a work in progress, and act on those things. And where in the areas where you didn't do well, you're circling back because it's not a lost opportunity. Since you've had that interaction, you should always have an open mind to go back and address what you probably could have done better. And that requires humility.
And I appreciate that. And those who are just joining in, we have three great minds here talking about issues on how we can build our connections, more meaningful connections in 2022. And I appreciate you giving us your perspective because you've got a lot of, I guess, a wide perspective from a national standpoint, working with the ANA. So thank you for that. And then, I know with you, Sarah, working on a local level there at that wonderful organization at Vail, you're able to kind of give us a perspective from the community hospital aspect, which I think is very important in this conversation. And then Dr. Shabu, I know you work at a pretty good sized hospital out there in California. What are your thoughts on this subject?
Oh, I'm just going to, agree with what Dr. Kate said. There are so much rooms for opportunities, honestly, to rebuild the trust. I love networking. I love, collaboration and all those. I have seen a lot of mistrust. I've seen, a lot of people that feel that, they were betrayed. And what Dr. K said was just right. There should be a whole lot of humility here. People, leaders at all levels should own it and said, yes, even though when COVID came, people didn't know how to go about it. But at some point, trust me, there were level of mistrust and lack of transparency and all those. And now people, even in healthcare, people are quitting their jobs. People don't want to go back to the hospital anymore. People don't trust leaders anymore. So do we have opportunities to rebuild? Yes, there are opportunities to rebuild, but who is going to do it? So I'm glad that we're having this conversation so that leaders can look at, what they have done wrong somewhere or how they have misled. Probably not their fault, as a result of the system, but at least have the ability to own it. I love transparency a lot. Even like what I do in my own space is to find out something that is within my means to, to rebuild or to talk about, or something that is, higher than me. I remember one of my managers says that, oh, Chief, this is above my pay grade. There are some things that are above your pay grade, but at the same time, have that humility to communicate. Because honestly, people are angry, people are betrayed, people are, quitting, but they just need that communication. They need that. I think communication will be, the highest tool to bridge that gap, and we can move forward.
You bring up an interesting point. I'm curious about this with maybe the three of you. Have you found instances where maybe things didn't go as well as a staff member would have liked, but just the ability for them to be heard? Because I know you said earlier, Sarah, you talked about the coffee, a cup of Joe with the ACNO, I think you said earlier. Mm-hmm. If they feel like they're being heard, does that make a difference to them? Do you see that make a difference? Also, have you come into situations where nurses just kind of want to be, or just healthcare staff in general, want to be part of the solution, even though we realize, okay, there's some things we need to fix, but I also want to be part of the solution. So I'd love for you to kind of speak to that, Sarah, since you kind of had these recent talks with the folks on your staff. What's your take on that?
I think my most recent take is the teams are really collaborative and wanting to be part of the solutions, but also want to have a vision. I think we need a vision for our teams, and the visions have changed a bit over the last couple of years as we evolve in the pandemic. And I think what we've both have all spoken to is what is people are leaving healthcare, and how do we look at that as a team and maybe look at different care models together, abilities to look at different skill mixes. And that can't just be the leader making those decisions. It's shared governance coming together and saying, here's where we see an opportunity. How can we look at not only professional development for people that are there, but how do we work towards recruiting the right candidates that want to be in our environment and who and talk about what we can do differently to support healthcare in a new changing environment.
Appreciate that. I know because you've got a national scope with a lot of the work that you do, Dr. Katie Boston-Larry. What are there any similarities or any common answers we're getting as to maybe either whether it's a suggestion or maybe a problem that we have found some kind of answer to across the scope? Is there any similarities, commonalities we can find that you've observed
In terms of solutions?
Yeah, either solutions or problem with a solution. I know we're not going to be able to solve any problems in the next 30 minutes. So either one that's a solution or one where you've heard the problem, but you've also seen a solution too.
So I do think the biggest one is understanding the importance of institutions owning overall health and well-being of their teams.
Okay.
And not manage it in a way of, education about self-care or, giving people tips about what they need to do when they get home. It's really about integrating well-being in the workplace and how that sends a signal of mattering to their teams and feeling valued because what we're seeing and hearing is that a lot of overall, not just in healthcare and nursing, but overall, people in the workforce want to feel valued. And they like to see meaningful effort towards being valued. And being valued is not telling me, and one misstep was not major because some organizations and people felt that it worked, but some of the resiliency training that came during the pandemic. And you have most healthcare professionals saying, well, wait a minute, resiliency is how I got here. Like, what's this training about? How is it going to help me in having a broad brush approach? So it is really about if there's a real intentional work and focus on well-being, looking at addressing inefficiencies in the workplace, reducing workload to one that's reasonable, because there's language also about employee exploitation. That's a major issue in the US dating back to the industrial age, and how that's not working anymore. So it is really that piece of organizations that are starting to see some light are the ones that are making overall well-being a priority, investing in it, measuring it, and dealing with it and changing the culture. So that's what I've been seeing.
Awesome. Okay, so Dr. Chabu, I know with your organization, you've got the Nurses Bond, and so you're connecting with folks all over the United States, and I know you've got some in-person conferences, especially one of them's going to be right here in Houston, which I'm looking forward to that later on this year. Any commonalities, anything you've seen across the board? And then guys in the comments, thank you for all these comments. I'm going to get to those right after Dr. Chabu's answer.
Of course, yes. What I'm noticing is that, leadership presence, no matter what, like people are getting smarter now and people have learned how to speak up. Gone are the days when, people or professionals, they just ask you to go do things and you just go do it. Now people are looking, people are seeing. And, my colleagues here will tell you that there are some times you just go to the hospital and you do your treatment. Now, when patients come to the hospital, guess what happened? They tell you everything about them, all the treatments and everything. They just want you to do what they want, even though you are the one that have the license, but they want you to do what they have read on Google, So leadership presence is very important, to rebuild. And what does that mean? You just let people know. People want to be heard. They just want you to let them know the real truth and what is going on. So if you are coming and, telling them, oh, it's going to be all right, and they know that it's not going to be all right, then you are fooling them and they're not going to trust you. There is no transparency right there. If it is, oh, it's not, it is what it is. And if people want to cry, they cry, because cry is also good. If they want to make decisions, but you let them make decisions based on the truth, rather than, just go do it, just go do it. Sometimes, the people in the, what's it called? In the C-suite, not C-suite, the people, the stakeholders, we just tell the C-suite, okay, this is what we want you to do. But they don't know actually what is going on with the staff, with the team members. So right now, I think what is best is for them to actually go look at what is going on. Just make that. It's no longer about money. It's about lives. It's about values. Everyone deserves that respect. Everyone deserves that value, irrespective of, their level in the organization. So I think that is very important. And what we are doing, like you have mentioned in Nurses Born, is bringing people together, to share their stories, to share their ideas and values. And we work together to see how we can help them, and that has helped so many people, because before, people didn't have avenues to come together to work as a community, to speak up so that they get help. But right now, with what we are doing, even with Nurses Born, we bring people together, we collaborate, we network, people share their stories. We use it to empower people to live their best life.
Love that. Okay, I got lots of comments here to read. Thank you for all these comments. In fact, you know what? But while I'm reading these comments, I want you guys to think about a question I want to ask you next. I had it up here and I'm trying to pull it back up. Some of these are just too crazy to ask you guys right now. Okay. Would you rather? I don't want that one. Would you rather be stuck in an elevator with someone for 2 days? I'm gonna do this. Let's say 6 hours. 6 hours with someone who talks too much, or with someone who won't talk at all. Okay, while you're thinking about that, those are comments. I want you to answer the same thing, but I'm going to go ahead and read some of these comments, and then you guys can tell me your answers, okay? All right, so as far as responses to what you were saying earlier, make sure I get down to it here. She says, I agree with Sarah about transparency, but also feel being transparent is not enough. Leaders need to talk the talk, then walk the walk, implement the change, and or continue to update staff as to why the change hasn't happened or won't happen. You can't and won't be trusted if your communication is not up to par. Okay, before we read another comment, I'm gonna give you an opportunity to respond to that, Sarah, if you'd like.
That's really good feedback. I agree. I think transparency includes that. It's not just saying what we're going to do, but listening and hearing and having loop closure and following up and being real, like we talked about. And if it's not all great, recognizing that and working together. I think walking the talk not only just means having meetings, but being a part of the team and walking alongside them. I spent some time doing things that I never thought I would do in this pandemic, and we all have done different roles. And part of that is being able to show that we are in that and we want to make a difference and show our vulnerability. I think is very important as a leader. We need to be vulnerable to be able to ability to make change and get trust.
Love it. I love that. That's a great answer. Okay, Benjamin. He says, I don't think the pandemic caused the decline in trust as much as the political, economic, and social chasms that were exposed when faced with one of the greatest challenges of modern civilization. For example, we saw frontline healthcare workers praised as heroes as they worked through the beginning of the pandemic with little PPE and no vaccine, and then turned around and then fired the same exact heroes for opting not to get a vaccine a year later. How can you ever trust the organization again after that kind of betrayal? Wow. Wow, Benjamin, I wasn't expecting that when I was trying to read that comment. Okay, so let's address that. So Chabu, what would you say to that? Dr. Chabu?
Yes, I hear you, Benjamin. And I would just like I said, I'm very transparent and all the same. Yes, when pandemic started, is only, remember what I just said last time? Some people are just in the boardroom and making decisions, and they don't know what is actually happening in the units. You know what I mean? So unless you go out there, talk to these nurses, witness it, then that's when you have the feeling. So I don't like, that's why I say leadership presence. I don't just like people making decisions in the boardroom without actually getting to know what is, going on. Like what Benjamin said. Yes, we went through pandemic. I was right there, and we didn't know what, we didn't know what to expect, and we did it. Now, sometimes I believe I'm vaccinated. I love it. I believe in it. That it's not harmful, according to science, because I'm also, a researcher. But at the same time, people also have their opinion. So I don't know where I would say whether trust or not trust, but at least I think safety is number one. So anything that
Yes.
keeps us safe, I don't think is trust or mistrust. At least the like I said, you have to be intentional. What is the end goal? Safety. So
Yes.
whatever can keep us safe, that's what it is. So I don't know. You might trust it, you might not trust it, but at the end of the day, what are we or what are they trying to achieve for everyone
Yeah.
to be safe? So as long as you know the goal, then you walk towards it. I know, there are activities that might not be pleasant to everybody, but just look at the end goal instead of looking at, how it favors you or it doesn't favor you.
Yeah. Because, and Benjamin, I feel you. Look, I feel you where you're coming from. But at the same time, I'm thinking of, okay, what about the patient? What about the other workers who work with this person? There's just so many other factors outside of this this person's personal decision. So I've just seen it. I've seen it from the other side where I was like, ooh, okay. But I appreciate him being vocal about his opinion. So thank you for sharing that. Okay, Dr. Rosina, she says, oh yeah, many missteps and failed leadership during the pandemic. Seen it across the country as I travel. She's a travel nurse. And it was always there. The pandemic just highlighted it, brought it out. Many nurses have lost faith in the various systems. Question now is, what are these leadership now doing to fix it, or are they just letting the status quo prevail? Okay, so Dr. Katie Boston, what's your standpoint on this? I have thoughts on this, but I want to hear your thoughts on what do you think is happening now? Do you think it's status quo, or do you think we're looking at fixing it?
I think it's more fixing it, but the question is fixing whether it's being fixed for, for a long game, right? For sustained success versus the nipping and patching and tucking that's probably happening now because of the biggest issue, which is staffing. Which is also connected to the work environment and the culture that people have to practice within. And again, to the earlier discussion around, perceptions of leadership. So it's really a mixed bowl of issues right now. We know from our data of 13,000 nurses that from a survey we conducted this year, about 13,000 nurses have staffing as their number one issue. And the number two issue is that their work is impacting their mental health and well-being. So those are two very complex issues to fix. And I don't believe that there's any status quoing going on unless someone's working in a very low acute ambulatory setting that has been completely untouched. But it's hard to imagine any setting where care is delivered that's been untouched or not negatively impacted by what we've seen over the last couple of years.
Yeah.
So the key is not to, so the status quoing may be happening in terms of the relationships. And I think we talked about this earlier. It's okay, the same typical approach of, engaging the team, doling out assignments, doing performance appraisals and all that. And those are the structural things that has to change. I'm at AONL right now, and there's talk about, some of the words that we've used over the years and how that needs to change, where instead of job descriptions for nurses, there's a privileging aspect to what nurses do. There is not using the word training because it lessens the professionalism of nursing, and using words like education. Healthcare workers versus healthcare professionals versus healthcare workers, not saying bedside nurse, not saying frontline nurse. So there are all these pieces that's also in play. It's a very dynamic environment right now where words could just turn every conversation in the wrong direction, even though that may not be the intent. I actually just did a presentation, and I used the term regarding, signaling for help if you feel that you're in mental health crisis and you're working, and I use the term white flag, and there's someone that was in the audience that said, "Oh, you can't use that. There's a racial connotation to it." I was like, "What? Like, when did that happen?"
Wow.
So it's so hard to know what to say these days, and the sensitivity that you have to apply to all. But the key is it's not going to be business as usual, and no one should ever be thinking about a return to normalcy, whatever that was. It's really about how we need to set our teams up and ourselves up for success with the long game in mind. That's what's most important, and be progressive and innovative. And all the barriers that used to be in place that prevented people from innovating, one being cost, people are paying through the nose now. So this is a time to leverage those funds differently to be better, and to have a model to earlier point that is sustainable for years to come.
Mm-hmm. Now, you bring another interesting point that I do want to explore a little bit is the words we use, being careful, what we say. But then at the same time, you still have to communicate sometimes some very tough issues, and you want to be relatable to whoever your audience is. So that's a good thought. But we didn't answer our question yet. So, Sarah, would you rather be stuck in an elevator for 2 days? No, not 2 days. I said 6 hours. For 6 hours with someone who talks too much, or someone who won't talk at all?
I think I'd rather be stuck with someone that talks too much. I think there's always an opportunity. I know it sounds crazy, but I love to learn how to listen better in my life. And I think when someone's talking too much, it's going to really help me learn how to listen to what they're trying to say and understand them. I think if I had to talk the whole time to someone that wasn't talking, it would be hard for me to. At least I can converse with the other person.
Okay. That's very plausible. Okay, I like that. I appreciate your perspective on that. Okay, Dr. Shabu, what were your thoughts? Would you rather be stuck in an elevator with 6 hours with someone who talks too much, or that won't talk at all?
As a teacher, I rather stay with somebody who talks too much. We will talk about everything in life. I like to talk myself, so I can never be tired of listening to people. We sharing views and all those. I don't mind, but having somebody that doesn't talk at all will kill me right there. Because I know, as somebody who is hyperactive, you can't just give me someone that doesn't talk at all. I want to know your view. I want to know what is in your head, and I want to get everything out. So if we are there for 6 hours and you talk too much, I will love it. And that 6 hours will be like 30 minutes for us. That's me.
Okay, how about you, Katie?
I am not where these guys are. I would say I would rather. I just think about my Uber rides sometimes. It's like I don't want, I don't know. I don't know that I want someone that's going to talk me to death for 6 hours. That's sometimes even a 20-minute ride in an Uber with a talkative driver. I struggle with that. So I'm going to go on the other side. And, again, Rollins, it's lesser of two evils because I'd rather be in the middle. But if I'm being forced to choose, I don't think I want someone to talk so much. It'll wear me out. And people don't believe this, but I'm pretty much an introvert. I really am. So I value quiet, my space, and I married someone who's the same way. So we could sometimes be in the same house and not talk to each other for hours on end, and it's cool.
No hard feelings, right?
No, because when we finally do get back together in the kitchen, maybe 4 hours later over dinner, it's magic. It's awesome. It's an absence to make the heart go fonder. So I can't. I don't know that I want to talk her for 6 hours. That'll kill me.
Okay,
I love that.
So Dr. Rosina, she says, totally agree, Dr. Chabuna. People have changed, both patients, caregivers, and providers. Cassandra says, I'm an introvert, so put me in an elevator with a person who doesn't talk at all. I will talk to myself in my own head. I've mastered this.
There you go. That's my girl.
And let's see, Rosina, she says, stuck in an elevator with someone who won't talk because I've been in the company, not stuck in an elevator, many times whereby I have influenced a person or patient into conversation by my verbal and nonverbal behavior. So she feels like she can get them talking. Okay. Very good. All right. So what I would like now, as we start to land the plane here, because we're coming towards the end, what advice would you give to someone who wanted to communicate with you? So, because I think that the reason why I want to ask it that way is because we can learn just from hearing how you want to be communicated with, how we might perhaps adjust our approach in communicating with someone who we have in our purview at the time. So how do you prefer to be communicated with? Let's start with you, Dr. Chabu. What do you prefer when someone's communicating with you? Let's say it's at an event, a conference, because you're going to be holding a conference here soon. How would you like someone to approach you and communicate with you?
2 ways. Number one, know what you want. If you're approaching me, know what you want so that we know what to talk about, or don't know what you want and own it. And just tell me, I want to do this, but I don't know how to go about it. Because I don't know, you guys know, I've been teaching, I'm a professor too for over 12 years now. I talk to students and I teach students and all those stuff. Some people, don't know what they want, and you have to bring it out, in them. And whereas others know what they want. If you want to communicate with me, tell me directly. Remember when we started, I told you I'm very intentional. Tell me directly what you want, where is this going? Or I just don't know, so that we can figure it out together. So, I don't want someone that is in between. You don't know what you want. I used to tell people there's a difference between knowing what you are doing and knowing what is doing you. Some people know what they are doing, they don't know what is doing them, or they know what is doing them, they don't know what they are doing. So I would like you to either know what you're doing or just say, hey, I just want us to communicate, but I don't know where this is taking us to. Then both of us will figure it out.
Okay, I appreciate that. Okay, so guys in the comments, I want you to answer the same question. How do you prefer being communicated with? Okay, Sarah, how about you?
I prefer direct communication that's more collaborative. And I think that that's what you're getting at, is coming to a conversation with some solutions or ideas in collaboration, willing to listen, but also willing to share ideas is important in how I communicate. I also, just my way of communicating, I do appreciate personal connections. So if someone just wants to come and talk about their pet goat, that's fine too. It doesn't have to be real deep and focused. I think there's times in our lives where we don't take the opportunity to have personal connections and just build that. Dr. Chabu mentioned at the beginning that life is about personal connections, and that's so important. So for me, sometimes it's just whatever the story comes my way, I'm happy to be a part of it.
Love that. Okay, how about you, Katie?
I agree with both Sarah and Dr. Chabu. I think it's really having an open mind, being clear And it depends on the relationship, right? Like, there's some relationships like mentoring type relationships or student relationships, teacher relationships where they may not know what they want. And helping them, especially in coaching, you're being a thought partner and helping them figure it out, not that you're giving them the answer. So it depends on the relationship, but it's important for people to be able to be honest with themselves in terms of, and be willing to do the work to understand themselves better when they do come, so that it's, because the hardest conversation is, I found, is with folks that don't have self-awareness. Like those are the toughest ones, where you don't want to be the bearer of bad news, and you don't want to break someone's spirit. Especially if you're going to tell them something about themselves they'd never heard that's going to disappoint them. And especially they think that they're up here and they're really not. So it's really, hopefully someone is pliable, open, and also has a sense of humor that doesn't take themselves too seriously, and appreciate that this is all a journey. Like, life is a journey, and what you may have planned to do with your life when you were coming out of high school, it may change based on a number of factors, and being open to what's available to you and making the best decision.
Okay, very good. So I have to read this. Benjamin wanted me to restate or re-clarify what he had said earlier. He says, for the record, I want to be clear that my comment is not my opinion, and nothing was stated based on my beliefs, but rather an observation as an outsider who watched this happen. Your question was about trust, and I simply gave an example of how trust was broken. So I want to make sure I read that to you guys. Devin, hey, Devin is here. Good to see you, Devin. He says, thanks, Katie, for sharing that data regarding staffing and mental health being number one and number two concerns for nurses. So thank you for your feedback on that. Appreciate that. Okay, really quick question before we go out. Phone, text, email, or messaging app? Let me know in the comments what's your preferred mode of communication. How about you guys? Let's start with you, Chibu. Which one of the four?
Phone. Why is because, text can be misconstrued to be something different, especially all of us are not from the same, group, racial group, or even from different states. So the way we communicate is different. So I rather hear you, then if I need anything, I clarify, than text.
Okay. How about you, Sarah?
I'd say that's a tough one, because it probably, just like we talked about situations and communication, but I agree. I do prefer phone. I think some things do get lost in translation. I do not like email. I don't do a good job of communicating that way, and also don't, I don't myself or do well reading it and understanding it. So I'm more of a verbal learner.
Katie, what about you?
I think it's all the above. You keep throwing these questions out here that, come on. Like if it's someone I don't know, I don't want you to call me initially. I want to know what you're about. I want to read about you see it on LinkedIn too. You have people reach out to you like, hey, do you have a few minutes to chat about this product that I have? And you go, could you send me some information about it first? Like, I don't want that person calling me off the bat. So it's all the above. But family, you definitely want to connect with them via phone or in person, actually, and not text or email. But
All right, very good. Well, listen, thanks to you for all of your time today. I really appreciate it. Guys, in the comments, let me know what you guys think. Phone, text, email, direct messaging app. Really appreciate what you guys are doing to contribute to healthcare. So I want to thank each of you for that. And then also thank you for being here. And folks who are watching, please look at their backgrounds. You'll see that why I picked them. This is an amazing group today. And hopefully you guys will come back and join me again. How about that?
Excellent. Yes. I can't wait to see you in person. Remember?
That's right.
So I love that personal connection. So we are coming to Houston, Texas for our conference. So
absolutely. We're going to put that link in there. Guys, Joanne, if you can put that link in for the conference, for Dr.
Ellis conference.
Yeah.
So Ellis conference, Nurses Bond is doing our 4th annual conference. It's called Ellis Conference, which is Education, Leadership, and Entrepreneurship Experience Conference. We're going to have it in Houston, Texas, October 21 to 23. And I haven't met Rollins before, and this is opportunity
Yeah.
to meet. And so many of us are coming to Houston, Texas. So if you are free, please join us. We're going to experience the difference, because all these things we are talking about, we're going to talk about it there. People are going to use their stories, personal connection to empower others to grow. So this is where personal connection is very important.
Absolutely.
And you will experience the difference.
Who knows? Maybe Sarah and Katie can join us.
Yes,
they
will.
I'm already in your side of the world, but I'm leaving tomorrow morning. I've been here all week. It's time to go home. I got to be with my family. Human connection.
That's in October. That's 6 months. Don't worry. By then we want to see him again.
Well, listen, I want to be respectful of y'all's time. We're already past our 3, but I really appreciate both you guys, all 3 of you being here today from varying circumstances, from Vail, Colorado, from California, from here in Texas. Thank you very much. And guys in the comments, really appreciate all your comments. I'm sorry I didn't get a chance to read all of them, but I will read them right after this is over. Thank you very much, everyone. Let's say bye, everyone. Bye.
Bye.
Bye, guys.
Bye.
Bye.
Thank you.
Thank you so much.
Thank
we
you.
Appreciate you.
Yes.
All right, y'all.